So let's talk anaphylaxis. Now, you've probably heard of this before. Anaphylaxis is much more than just a simple allergic reaction. So let's look at it closer and let's hit the highlights. This is a severe, extreme allergic reaction with rapid onset. It usually results in a massive histamine release, and it obviously can be life-threatening.
Click the link below or visit nursing.com/NFN for a free NCLEX ebook covering the 77 key topics.
So remember, the purpose of histamine is it responds to an allergen. So when I have contact with something I'm allergic to, I get this strong histamine release. This could be something like any kind of food, could be a medication allergy, or things like peanuts, bee stings, or even latex, which is one we always have to be cognizant of in the hospital. And so this histamine gets released and it causes an inflammatory response, and it causes swelling. And that's just part of what histamine does. And so it really can be life-threatening if untreated. What specifically are we going to see in our patients? Where we will see urticaria, otherwise known as hives. And that's like what you see here, these raised red bumps, and they're usually very itchy. And this could be anywhere on the body because this is a systemic response. It's throughout the whole body. The second thing we see, and the reason this can be so life-threatening, is the angioedema. Angioedema is swelling of the face, lips, tongue, and throat. So if you hear someone say their throat closed up, this is what they're talking about. So you can see here how this man's tongue, the side of it, is severely swollen on one side. So the problem with this swelling in the mouth is obviously that it can compromise their airway. And so we're very concerned about addressing the situation. You may see swelling in the airway, and you could even hear things that sound similar to asthma, like wheezing or stridor. We're also going to see skin flushing because histamine releases chemicals that cause massive vasodilation. So anaphylaxis can actually lead to anaphylactic shock as well. So these patients are at severe risk for hypotension and even cardiac arrest if we don't treat the situation quickly.
If you need more help breaking down complex topics like this one, make sure to head over to nursing.com/NFN. Click the link in the description below or scan the QR code to unlock your free NCLEX review that covers 77 must-know nursing topics. Make sure that you learn this, that we love you guys. Now go out, be your best self today, and as always, happy nursing.